Okay, welcome everybody to section number 3. We just wrapped up section number 2, which was about the Community Connection for Older Adults newsletter. And what we're going to be talking about in this section is about core issues that are currently impacting older adults that, as an ambassador, you might get frequent questions about. So anything that you see that has sort of a navy blue colored banner means we are still behind tab number 3 in your manual. And tab number 3 starts on page 8, okay? So among the most frequent questions and inquiries among older adults are about how core issues impact them as they're aging, or for example, if they're caring for an aging family member, because many older adults cannot afford the most basic of needs, nor do they understand the benefits that they're eligible for. And then we have health and wellness. So whether it's physical injury or mental distress or sickness and disease, these are just a handful of the core issues that currently concern many older adults. And then social engagement. This can be really difficult for many older adults because they may live in a rural area. Their circle of friends may be starting to close in on them because they're passing away. Maybe their spouse has passed away. Maybe their children are spread out across the country. So we want to make sure as ambassadors that we really help older adults stay engaged with other people. Safety. Sadly, there are those that are going to prey on the frail and seemingly defenseless. Transportation. How are older adults going to get around? How are they going to go grocery shopping and get to doctor's appointments? And then caregiving. Discovering that one is unable to continue caring for oneself can also cause lots of mental distress. And so what we're going to do is look at each one of these 6 bulleted items in more detail, and then I'm going to let you know which ones apply primarily to low-income older adults and which ones apply to older adults with no income issues at all. And we're going to get started with basic needs, because if basic needs are not being met, then the other 5 become less important. And the 4 areas we're going to talk about under basic needs include food and housing and utilities and clothing. So let's get started with food, because food would seem to be a relatively simple topic, but in fact there's a lot of insecurity around food. Is it available? Is it accessible? Is it easy to prepare? Is it nutritious? And so ambassadors who can make referrals to congregate meals and food pantries, home delivered meals, food stamps, and emergency food is the right thing to do. And this applies primarily to low-income older adults. And then housing. So dire is the housing situation for many older adults that some end up homeless and ultimately victimized. And when the largest chunk of an older person's income goes towards housing, that leaves the remaining funds having to be divvied up between food and utilities. And so ambassadors want to make sure that they address issues such as overcrowding and safety conditions and poor quality. And this really applies to all older adults regardless of their economic status. And then we have utilities. Utilities can be extremely expensive for older adults to run. And when the largest chunk of an older person's income goes towards housing, it would make sense that the second largest chunk would go to food, leaving utilities in a distant third. And so referrals to utility assistance programs is helpful. And this really applies to low-income older adults. And then clothing is a huge drain on an older person's income. So ambassadors who can make referrals to clothing closets and thrift shops is the right thing to do. And this really applies to all older adults regardless of their economic status. Now let's talk about the benefits that some older adults may not even know that they're eligible for. And so we're going to talk about Medicaid first, which is a state and federally funded program that provides medical care for low-income citizens. And then Medicare is a federally funded program which provides health coverage to people who are 65 and older. And then we have Social Security, which is a federally funded program that provides economic assistance to the disabled and the elderly. And then Veterans Affairs is a federally funded program that provides health care benefits and burial services to those that served in the military. Now, certainly not all older adults are eligible for Veterans Affairs, but we thought this would be a good spot to put it because we really wanted to honor the service of those who have been in the military. Next is health and wellness and social engagement. And so educating older adults and their caregivers about the philosophy that pennies of prevention is worth dollars of cure is important, because ambassadors who can make referrals to prevention types of services providers help make the early detection of such diseases as high blood pressure and diabetes and cancer and even an annual flu shot that much easier to treat and that much less expensive. And so ambassadors who can make referrals to free and low-cost clinics are doing the right thing. And then as older adults continue to age and they're going to face more and more significant life changes that can put them, at great risk for mental health types of issues, especially when older adults don't have a strong support system in place. And so if their medical problems continue to escalate or something tragic happens like their spouse passes away, one of the mental health issues they're especially prone to is depression. And so ambassadors who can make referrals to free and low-cost counseling is appropriate. And so those first two bulleted items really apply to low-income older adults. And then we have social recreation. It's been proven in study after study that older adults that get engaged in social recreational types of activities experience a much greater quality of life and more life satisfaction than those that don't. And that really applies to all older adults, regardless of their economic status. Next is safety. And so unfortunately, older adults are the #1 targets of investment con artists and fraud and abuse. There are tragic examples of older adults who've been robbed and cheated out of their entire life savings. And so the neglect and exploitation of older adults is really a national epidemic. And so no matter what the socioeconomic status is of these older adults, they're all equally susceptible to this type of fraud and abuse. So it's up to government, law enforcement, the judicial system, home health care providers, caregiver agencies, and really the general public to protect this vulnerable population. And so ambassadors who can help older adults by making referrals to services and programs that can help educate them about ways to protect themselves and what their legal rights are is extremely helpful. And so all of this information applies to all older adults, regardless of their economic status. Next is transportation. And so when an older adult has to give up their car keys, this can cause lots of mental distress because they may experience feelings of loss around their own mobility and independence and freedom. And so many older adults have to rely on others for their transportation needs. And even if they live in a metropolitan area like Austin that has various types of public transportation options, this is not a panacea because many older adults have trouble walking, much less boarding trains and buses. And then there's the additional barrier of getting access to pick up and drop off locations. And then at some point, older adults are likely to interface with emergency and non-emergency medical rides. And so emergency medical rides would include ambulances, non-emergency medical rides could include for-profit businesses, government-funded programs, and nonprofit organizations. But one of the keys to this transportation dilemma for many older adults is the use of the volunteer transporter. And one of the reasons why this program is so successful is that it's economic to run because volunteer transporters, they use their own vehicles and they operate without compensation. But then they also provide the additional benefit of companionship as they accompany older adults to their meetings and errands and appointments. So all three of these apply to all older adults, regardless of their economic status. Now, the last core issue we're going to talk about is caregiving. And so caregivers have to be adequately and appropriately trained so that they can help families and unpaid caregivers seek subsidies so that they can afford the services of a paid and professional caregiver. And then communication with the care recipient is not the only must. There will likely come a time when an older adult needs to work with medical professionals. And this can be a new and daunting task for those who've never worked with the medical community before. So we're talking about home health care, hospice care, respite care, elder care, and other types of caregiving agencies. And then there are more than 10 million adult children over the age of 50 who are currently caring for an aging family member. And this is happening at precisely the same time when they need to be planning and saving for their own retirement. And so those with the heaviest responsibilities are experiencing their own physical decline and mental distress and economic hardship. And over the next 25 years, as baby boomers continue to age, the need for these caregivers is going to only increase. And this applies to all older adults, regardless of their economic status. So that wraps up section number 3 about core issues. Next will be section number 4.